Board of Health, and the Metro Coronavirus Task Force. This morning, we'd also like to welcome Vonda Mcdaniel, President of the Central Labor Council of Nashville and Middle Tennessee, Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of the Metro Public Health Department, are here with us to help answer your questions. We'll now begin with Mayor John Cooper.
Good morning, Nashville. I want to begin this morning by thanking everyone who is continuing to follow the Safer at Home order throughout Davidson County. You are helping to further flatten the curve of the coronavirus in our community, and you're supporting our frontline healthcare workers and saving lives as we work towards safely reopening our local economy. Now, our latest public health data does not today support the start of phase 1 for the roadmap for reopening Nashville. But the results from the last 2 days put us clearly on the right track. We are close. We are meeting much of the important criteria contained within the framework, including hospital bed capacity and the ability to conduct county-wide contact tracing investigations. Based on recent active case data, if we average around 80 cases a day over the next several days, while continuing to meet our other public health benchmarks, we can enter phase 1 of the roadmap for reopening Nashville, which will enable local restaurants, bars that serve food, retail establishments, and commercial businesses to open at half capacity while observing social distancing protocols and other public health measures. Dr. Alex Jahangir will discuss this metric in more detail momentarily. Now, much of our general healthcare system has reopened today as a prelude to getting to phase 1. We will need a robust health system to be in place as we get ready to reopen the rest of the economy. I know that all Nashvillians are eagerly anticipating the reopening. Business owners and their employees are ready to get back to work, and residents are anxiously awaiting the opportunity to resume a more normal daily routine. I share your sentiments. Since we first started considering how Nashville will restart our local economy, we've been committed to a data-driven approach that prioritizes public health and ensures a successful reopening. It requires the confidence of both consumers and workers who make up the heart and soul of Nashville's economy. We must earn that confidence with a balanced approach that ensures that all Nashvillians, all of you, can safely participate in our local economy, business owners, employees, and customers. By taking the appropriate precautions today, we can further mitigate the spread of the virus and hasten a complete return to business as usual in Nashville. As health policy experts uniformly agree, every additional day we can stay and safer at home will increase the likelihood of getting through all subsequent phases faster and more successfully, including the higher probability of being able to reopen schools on time in the fall. Today's public health decisions will lead to earlier and more certain restart dates for our upcoming school year, for major fall and winter professional sports, our global tourism industry, and other events that have a significant impact on Nashville's economy. Now, beyond our economy, Nashville's older adults over the age of 65 and those with underlying health problems also are depending on a safe, stable condition throughout Davidson County. Now, in the interest of transparency, we've published a COVID-19 dashboard this morning that displays several important public health metrics in an easy-to-read format, accessible to all Davidson County residents. You can review this dashboard at Metro's COVID-19 website by visiting covid19.nashville.gov. Now, these Metro COVID-19 dashboard measures include our coronavirus transmission rate, the 14-day new case trend, public health capacity to conduct contact tracing investigations across Davidson County, COVID-19 testing capacity, and the hospital capacity with both regular beds and ICU needs. Now, Dr. Jahangir will provide more details on the COVID-19 dashboard and the frequency at which it will be updated. Now, at my direction, the Metro Public Health Department this morning will issue Order Number 4 to help advance us towards Phase 1 of our economic reopening strategy. Order Number 4 strongly urges all residents of Nashville and Davidson County to wear face coverings when out in public, per CDC guidelines, to mitigate the spread of the virus. Businesses are expected to post signage and to require their employees to wear face coverings. Remember, we will have the virus with us until there is a vaccine. Until then, just as all Nashvillians and their passengers should use seatbelts and child seats in moving vehicles, a global pandemic calls on each one of us to take certain personal safety precautions in our daily lives. The use of homemade face coverings will safeguard your health and help ensure the well-being of those around you to reduce our overall infection rate and reduce the spread of the disease. Now, this morning, I want to welcome Vonda Mcdaniel, president of the Central Labor Council of Nashville and Middle Tennessee, who is here to discuss the importance of public health measures that employees are taking in preparation for our phased reopening, and what workers across the city can do to protect themselves and each other during this time. I am so grateful to all Metro employees, many of whom are at the front line of our city's coordinated COVID-19 response, and all of whom are essential to providing important services to Davidson County residents. And today, in great news, I'm glad to announce that the Metro Civil Service Commission has approved hazard pay at the rate of an additional $3.13 an hour for those Metro personnel who are directly responding to the coronavirus, including our first responders and public safety officers. Metro's hazard pay will be funded by Nashville's Federal CARES Act disbursement, which must be allocated exclusively towards COVID-19 related expenditures. Now, as I mentioned yesterday morning, our office is presenting a series of informative webinars hosted by Dr. Jahangir and other public health officials designed to help local small business owners adapt to this new era of social distancing. Webinars will be held this afternoon for restaurant owners and operators from 1 p.m. to 3 p.m. and featuring Martha Boyd of Baker Donaldson, Benjamin Goldberg of Strategic Hospitality, Derek Moore of Slim and Huskies, Manuel Delgado of Delgado Guitars, and Mark Faulkner of Vireo Systems. To learn more about these free webinars, visit Metro COVID-19 website at covid19.nashville.gov. And as always, I urge you to visit Metro's COVID-19 website and consider donating to the COVID-19 Response Fund. There you can also learn how to obtain direct financial, food, mental health, and social service assistance. And I'll turn it over now to Dr. Alex Jahangir, chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on the coronavirus in Davidson County. We now have 2,669 confirmed cases. That's an increase of 57 cases in the past 24 hours. We had an additional death yesterday, a 68-year-old gentleman. My sympathies go out to his family. That brings our total fatality count to 25. There are an additional 2,272 cases in the surrounding counties, bringing our total for the region to nearly 5,000. Of the Davidson County cases, 1,233 are currently active cases, and 1,411 residents have recovered and have been cleared. Now, as the mayor said, the Safer at Home order in Nashville has been extended. From the start, we've let the data drive our decisions. In our roadmap for reopening Nashville's framework, we have identified goals for the key metrics before we begin phase one. And when we review all the metrics, our determination is that we are not where we need to be to reopen. When you look at the dashboard, the transmission rate and the 14-day case trend are yellow. Our goal for transmission rate is below 1. That means that on average, a person with the virus would infect one other person. For the virus to be contained, this number needs to be under 1. Currently, it's at 1 for our region. For the 14-day trend of new cases, our goal is to be flat or decreasing. This would mean that we will be ahead of the spread of the virus. Currently, the trend is increasing, so the metric is yellow. Over the last 14 days, we have seen our case average increase, and I hope this is now plateaued. In the next week, for us to maintain or improve the trend, we need to average 80 or less new cases per day. Public health capacity is green. We forecast needing between 28 to 106 investigators to conduct contact tracing for our city. Currently, we have 82 investigators and plan to add more. Now, contact tracing is important as we reopen. This will enable us to investigate new cases as well as isolated outbreaks that may happen quickly. We have to get in front of it so we can contain them and not let it spread. Testing capacity for the city is green. We need to have a robust testing system in place when we open. With our healthcare partners and our community assessment centers, we have the capacity to test more than 5,000 people a week currently. Hospital capacity is also a big indicator. Both hospital beds and ICU beds are green. Right now, we have the capacity in our hospitals. We will continue to monitor these metrics closely because as hospitals open up to more elective procedures, their capacity will go down. Now, over the next few days, we will be looking for improvements in these metrics, especially the 14-day trend of new cases. And this will guide us as we continue to look to reopen the city. Now, as I've mentioned before, multiple metrics, not just a single one, will be used to help our decision on reopening. And you can see the dashboard and additional data on our website, covid19.nashville.gov. Now, before we move on, let's talk more about testing. From the beginning, we have said we need a robust testing system in our city. Our community assessment centers have provided a big supplement to our testing thanks to our healthcare partners. In fact, already this week, we have tested 1,600 people. And as we reopen, our residents will continue to need more access to testing. So beginning next week, our 3 community assessment centers will be open 5 days a week, Monday through Friday from 9 to 3. They will continue to provide free assessments and testing for Nashvillians, and this will add to our already robust access to testing we have in our city. In addition, we will have teams ready to do mobile testing for long-term care facilities and to reach out to members of our community that may not be able to go to the hospital or assessment center. This expansion will give us the ability to test even more people, and it will help us better monitor the spread of the virus as we reopen. Now, an update on the fairground shelter situation. Yesterday, 250 individuals, both residents and staff, were tested after it was discovered that 4 individuals there tested positive for COVID-19. We also believe that some of those who tested positive may have also been at the rescue mission. So today, in order to be extra vigilant, we will be testing residents and staff at the Nashville Rescue Mission. The Metro Public Health Department continues to investigate this situation, and we continue to work to contain the spread of this virus. Now, as we reopen, we may face situations like this again, and our public health resources are ready to respond just like they did at the fairgrounds. Now, finally, the Safer at Home order has been extended. That means that non-essential businesses will stay closed. That includes dine-in services at restaurants, retail shops, gyms, hair and nail salons, and no gatherings more than 10 people. Now, I know many of you are ready to get started with phase 1. I know it's frustrating not to have a date when we'll reopen, but stay focused and stay at home a little longer will help prevent a rebound of the virus. We don't want that. A rebound would reverse the progress we have made in flattening the curve, and the reopening process would take even longer. So I ask for your patience for just a few more days. Please stay at home, only go out if it's necessary, wear a face covering when you are out, stay 6 feet apart, and return home right away. We'll get through this, Nashville, and we'll get through it together. I now would like to introduce Ms. Vonda Mcdaniel, President of the Central Labor Council of Nashville. Thank you.
Good morning. Thanks to Mayor Cooper and your staff for inviting me as President of the Central Labor Council of Nashville and Middle Tennessee. The Central Labor Council is the local umbrella organization of more than 40 different affiliates and more than 20,000 workers and their families. Many are the essential workers that sack your groceries at Kroger, the firefighters, EMTs, and paramedics, the postal workers, and transit operators. They are the construction workers that have continued to work, the UPS drivers, and city government, and so many more. This past Tuesday, April 28th, Workers' Memorial Day was observed by the labor movement and its allies throughout the country. It is to remember all those that have suffered injury or died on the job. Through the advocacy of the labor movement, in 1971, Congress passed the Occupational Safety and Health Act. This year, Workers' Memorial Day takes on special significance. It's been 49 years since job safety laws were enacted in this country. Much progress has been made in making workplaces safer and protecting workers. But this year, with COVID-19, it is of utmost importance that workers are protected in the places of employment, front and center in the minds of everyone. But the labor movement is here to look out for workers, whether you hold a union card or not. A familiar story in the labor movement is about the canary in the mines. A canary in a coal mine is an advance warning of some danger. The metaphor originates from the times when miners used to carry caged canaries at work. If there was methane or carbon monoxide in the mines, the canary would die before the levels of gas reached hazardous levels for humans. As we reopen our economy and return to more normal activities, we want to make sure that the essential workers are not the canaries in the mines. Workers and their advocates should be full participants and must be involved in protecting ourselves and each other. We need to make sure that we are availing ourselves to all the safety protocols in what has often been repeated these unprecedented times. As we gradually open our economy in the coming weeks, there are a short list of things that you have a right to expect. You should know your rights. You have the right to expect adequate personal protection equipment and training as to how to use it. Understand disinfecting protocols and practice them. Make sure that social distancing measures are in place, that you have a sanitary and safe work environment, and that employers, in coordination and cooperation with local and state public health departments, conduct contact tracing of infected workers and remove exposed workers with pay without retaliation. If you feel that you are unsafe, there are agencies and organizations that are there to assist you. The Health Department, TOSHA, 311, and lastly, if you need assistance or support navigating these agencies, you can contact the Central Labor Council at 615-491-0453 or email us at aflcio@nashvillecoc.org, and we will connect you to the resources that you need. We cannot go back to what was not working before COVID-19, but you do not have to do it alone. This moment requires our collective responses and cooperation. Nashville is a great community, and working with Mayor Cooper, his staff, employers, TOSHA, the County Health Department, and others, we can make it through this pandemic safely. We will work together for our community that provides economic security, safe jobs, and a better life for all Nashvillians. We are committed to that. Thank you again, Mayor Cooper, for this time. Remember, safety first, brothers and sisters.
Thank you, Ms. McDaniel. We will now start the Q&A segment of today's briefing. I will announce your name, and you may proceed by asking your question over the air. We'll start with Stephen Elliott at the Nashville Scene and Nashville Post.
Hi, thank you. You said that you'll consider multiple metrics. Is there a scenario on May 7th when you haven't hit that 80 case average and you go ahead and start phase one?
Dr. Jahangir.
In short, sure. I mean, I think we are looking at multiple metrics. I think that 80 number on average, I mean, if it's 82, 81, I mean, let's not, I think that number is a reasonable metric to shoot for. But remember, as the mayor said, multiple health policy experts have shown that if we can just push off this decision for another week or push off this reopening for another week, the long-term benefits and return on investment is much greater than the 1 week of additional hardship that we may suffer. But yes, in short, to answer your question, there'll be multiple metrics we'll look at. Thank you.
Tosin Fakile at WSMV.
Good morning. Yes, I had a couple questions. How often will the metrics be updated, the ones that we're looking at online? And when it comes to people wearing face masks or coverings, can people be reported for not wearing it? Like, can that report be put on Hub Nashville for those who may not, for those who aren't? And for those who don't have any face masks, is there a place where the city can provide for them, where they can go to get one? And my final question to the mayor is, how soon will first responders see that money that's coming to them? Thank you.
So we'll have Dr. Jahangir address your first question.
Regarding the metrics will be updated. Each metric is updated at different times by the source, so we'll update them as regularly as the metrics are updated. I'm going to defer Dr. Caldwell to speak about enforcement of masks and the mayor to speak about the pay matter.
Good morning. Order number 4, requiring the postage of signage, is the most important element of this in educating the community. The requirement of signage says the following: dear customers and visitors, please help us to follow CDC guidelines by wearing a cloth facial covering or mask while in our business or facility. This will protect our employees and each other. In addition, we're requiring that businesses ask and require their employees to wear a face covering, but they should require, not shall. So we would like everyone to be educated, everybody to be wearing masks. There's not going to be a specific mandate for facial coverings, but we very much want everyone to follow it. We want there to be as much social pressure as possible, because when I wear the face covering, I am protecting you. So if you choose not to wear your face covering, you are saying to me, you are not trying to protect me. So I really want you to protect me too, because we are in this together. We are not going to ask people to report people not wearing face coverings on Hub Nashville, but we do want you to report if you don't see the proper signage. And we want to give everybody a chance to understand this order and help us all fight this together. Thank you.
Thank you, Tosin. On the matter of the pay, which is approved by the Civil Service Commission, this is money coming from the CARES Act, and federal regulations sometimes are hard to implement. It may be that this will end up being payable in a lump sum by December. That is not preferable, of course, and we're going to work with the federal government in order to smooth that out. But in all cases, it would be payable as a lump sum by December to our emergency workers who qualify for hazard pay under COVID-19. And let me be clear again on this. This is money coming from the Federal CARES Act. It must be spent in direct response to COVID-19. This is something that we would like to do on our own for our employees. Financially, we are not able to do it, but we are pleased that there is a path for the COVID-19 money to get to our first responders. And again, it may be in a lump sum by December, may be the conclusion of that pay.
Brett Kelman at the Tennessean. Go ahead, Brett.
Hey, everybody. Mayor Cooper, when you were speaking earlier, you talked about how good adherence to social distancing and good decisions now would pay off in the long run. And one of the metrics you mentioned was the possibility or increasing the likelihood of schools opening on time. Do you think there is a significant chance that metro schools are not going to be able to open on time next school year?
Mayor Cooper.
Well, Brad, thank you. That's part of the difficulties of this is that we have to avoid a relapse. Now, a relapse would jeopardize all subsequent future stages. And as difficult as it is, a school reopening is clearly a later phase reopening. And if each phase gets stalled or you have to backslide, then the whole economy risks being massively delayed. So the trick is to do this one time, is to do it right. It's a terrible analogy, but I think it's that extra round of chemotherapy. You may not absolutely have to have it before you're disease-free, but I think in this case, you're willing to go through that in order to ensure a better long-term outcome. This is why all the health experts that we are aware of, with all the models, all uniformly agree the longer you can stay and safer at home while it is justified in a rampant spread of the disease, the better long-term outcomes you will have. And so we're trying to be very cautious and get to that moment when we think we are in a stage where we are not likely to have a relapse. Relapse is what we're trying to avoid.
Julia Palazzo at WKRN. Julia?
Good morning, everyone. Thank you. Mayor Cooper, two questions for you. Do you have any updates on the possibility of furloughing city employees? And then I actually had a viewer ask me this question. Have you guys started talking about a timetable for making a decision on plans for the 4th of July fireworks show? Thank you.
Mayor Cooper?
Well, Julia, on Tuesday in my conversation with the council about the upcoming budget, we are making plans not to furlough employees. That's what we're doing. That's what this, in part, what this very large, massive, terrible property tax increase is going to allow us to do. Now, if we do not pass that level of tax increase, furloughing and layoffs of employees, unfortunately, will have to be considered and are being considered in 1,000 other cities in America. But I think Nashville has the determination to try to protect our valuable employees at this stage and have a platform for recovery. And that's what my Tuesday remarks were about, and we're doing everything that we can to prevent that from happening. Now, in terms of the timetable for the 4th of July, we're going to get there when we get there, but we need to get started and have no relapses, for sure, in order to get there. Now, the reality is, let me just go ahead and say, that's probably unlikely. That's a large social gathering. That's hundreds of thousands of people. I mean, it's possible for the disease rate to go to zero or somebody to invent a vaccine by that period of time or have some, remarkable technology improvement. But I don't think anybody in Nashville should be expecting that, though by then we expect most of the economy to be back and life is normal. But that, you would not necessarily have several 100,000 people gathered in one place. I think that would be viewed almost as a recipe for it would just take a few people in that environment to undo months of suffering that people have gone through and bravely lived through to get us to this point where we are, which is frankly, let's Nashville should pat itself on the back a little bit here. A month ago, we were talking about opening up an emergency 1,400-bed coronavirus hospital under the quickest possible conditions because it was felt that we could well need that. We responded. We are not opening and do not have to open up something of that capacity. We do feel that our healthcare providers are able to provide health care for the level of outbreak that we are having. That's an incredible achievement, and that was hard-earned by all of us. And if we were allowed to pat each other on the back, we should all be patting each other on the back. Thanks.
Nancy Amons at WSMV.
I thank you. I have a fairgrounds question. The CDC guidelines recommend not putting people in congregate housing, not grouping them all together. Other cities are separating their homeless populations, for example, using rented rooms, dorms, hotel rooms. I understand even the Millennial Maxwell House Hotel has offered hotel rooms. Why isn't the city doing that?
Thank you, Nancy. Dr. Jahangir will answer your question.
Nancy, I'd welcome you to visit this fairgrounds because it's not congregate housing, frankly. It's partitioned 46,000 square feet of a Metro-owned facility that's paid for. That is partitioned in a way that allows small groups of individuals to be together, and those individuals are together. And so when one person is positive in a small group, then as our public health team did so appropriately per CDC guidelines and other public health guidelines, they tested the people and as an extra precaution, tested the whole facility. We're grateful for our many hotels, Maxwell House being one of them, and multiple others that have made availabilities of the matter you mentioned. And if a need ever came to that, we probably would look into doing that. But right now, I feel that the plan we have is appropriate one that follows guidelines set nationally and locally. And again, this is an important population of individuals for us, so we want to make sure are taken care of, and we believe we're doing that well. Thank you.
Our last question is from Chris Davis at News Channel 5. Go ahead, Chris.
Good morning, Mayor Cooper. Because 89 Tennessee counties are opening up a lot of their businesses in the next few weeks, many Nashvillians may be tempted to go out to eat in Clarksville or get their hair cut in Murfreesboro. What's your message to Nashvillians? Are you okay with them leaving the county to use services that aren't open here in Metro?
Mayor Cooper.
Well, I'm grateful that the state has always recognized that the cities have a different risk profile and should have a different response. The Tennessee is combined of rural and urban areas, and the disease has a different path in those two areas. Each city, frankly, has a different level of outbreak. We in Memphis are very similar in the disease outbreak and our path. And I'm grateful to the state and the Unified Command for recognizing that there is a fundamental difference in the outbreak. And what you should do in one county may be different. What we are doing is keeping Nashvillians safe. Because of the density here and in cities, you do have a higher level of exposure, contact, and potential for problems, right? And that's what we're on, right? That's what we are addressing. Other places have a natural social distancing as people live further apart. And again, I think it goes to the, we just want to thank the governor and the Unified Command for understanding fundamentally that urban counties do have a different path with the disease and letting us get on with dealing with that here in Nashville.
I'd like to thank Ms. Vonda Mcdaniel for being with us this morning. A recording of today's press briefing will be made available later this afternoon. Thank you for joining us. This concludes today's Metro COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.